everyone. Welcome to another episode of Fridays with Fawn. I'm Fawn Lopez, Publisher Emeritus of Modern Healthcare. My guest today is Terika Richardson, Chief Operating Officer, Ardent Health Services. Terika is an accomplished healthcare executive with over 20 years' experience, as well as a track record of developing innovative programs that focus on patient centered care. She was also named one of Modern Healthcare top 25 diversity leaders in healthcare for 2022. Terika, thank you for joining me on this episode of Fridays with Fawn. I'm very much looking forward to our conversation this morning.
Thank you so much, Fawn. It's such a pleasure to be here with you today.
Thank you. And let's get started. So, throughout your career in healthcare, you've shown a commitment to placing the patient at the center of every decision. What does patient centered decision making mean to you? And why is it so important?
Yeah. I think our why is so important. Our why is our patient, why we make the decisions we make, why we create the services that we ultimately deploy out in the communities. It has one goal in mind, and that is to better take care of our communities and our patients. And so that patient-centered care is so important to me as an individual because I take it seriously. It's part of my personal why, but it's also a part of the organization's DNA. And I think one of the things that I would just highlight when we think about patient-centered care, it's not about how we think that we should treat someone else. It's about how that person wants to be treated. And that small nuance, I think, is the difference between good health systems and great health systems that have great patient attraction.
And also outcomes, right? It will
Absolutely.
result in better outcome for the patient.
Absolutely.
Thank you. So you joined Ardent Health in the middle of the pandemic, an extremely difficult time for healthcare organizations in the community they serve. What are some of the biggest challenges you have experienced in this role, and what are some of your biggest successes?
I would say the pandemic was an ultimate sort of moment and reckoning and humbling time frame for every healthcare leader across the country. And I would say one of our biggest challenges, the hardest moments I can remember, are just having such need for the basics, gloves, masks. The basic thing is to take care of patients and us scrambling to make sure that we had them in the right place at the right time to take care of the patient at the bedside. That was heartbreaking for me as a leader, for our industry as a whole. And let's remember that sole purpose around making sure supply chain could support the work, never having faced that sort of obstacle before. So definitely one of the biggest challenges. And our biggest successes, I would say, is how we've pulled out of it. I mean, some of the things that we created and the ingenuity, it's been pretty amazing. And I think to me, this is silver lining is when we've been talking about nursing shortages, Fawn, for 20 plus years, right? But the pandemic was really that sort of impetus for us to think about innovative solutions to try and solve this huge issue around workforce. And so we're seeing virtual care nursing now pilots across the country. We're seeing this remote patient monitoring outside of the four walls of the hospital to help with readmission, things we've been talking about doing, but now we really had that catalyst, that sort of fire to push these things forward.
Absolutely. And one of the bright lights about the pandemic was just for me, it was just seeing how the community, the healthcare community came together, and all of the innovations that happened during that period, and the collaboration by various stakeholders. That was really amazing.
I would echo. I would echo that wholeheartedly. Seeing those teams come together and people working beyond what was asked of them because they knew there was a need, helping out their team members. I mean, that level of camaraderie and even just camaraderie among systems too, right?
Yeah.
We saw that every level from the bedside to the corporate office, the
Yeah.
system collaboration across different systems just to make sure people have what they need. It was
Yeah.
heartwarming.
Yes, absolutely, and we thank all of the healthcare workers for all that they contribute to during that period and beyond. So so you are a very enthusiastic and passionate advocate for advancing equity, diversity, and inclusion in healthcare. What are some of Ardent's efforts in these areas of which you are most proud of? And in what ways do Ardent and other major healthcare organizations still need to improve?
Yeah. The notion of having a diverse workforce that brings various experiences, exposures, backgrounds to the table to come together to make solutions and to help lead our next phase of growth is so important. And I'm really grateful that here at Ardent, we have put a lot of emphasis around our DE&I efforts. So everything from having a platform such as Women at Ardent. It's a group of individuals that we bring all of leaders or women across different spectrums, various levels of their career, to hear about how to cultivate their career, to cultivate mentorship, to also cultivate the next generation of leaders beyond them. It's an ecosystem, right? And so I'm really proud of some of that work because it's allowed for us to further enhance the diversity of thought at the bedside and diversity of thought in the boardroom at the same time, which is it's been outstanding.
Terika, congratulations on being elected to the American Hospital Association's Board of Trustees last year. What do you hope to accomplish in your role on the AHA board?
Very grateful to be a part of the board of trustees. I think having this platform comes with great responsibility as well. My goal is that I represent health systems and hospitals and what we're facing both from the rural perspective to our urban areas, and allow for that voice to be heard, the day-to-day voice of the leader in that space. I'm also very much an advocate, as mentioned beforehand, around diversity, equity, and inclusion. And how are we ensuring that we have a pipeline of leaders ready to take the helm that represent the communities that we are so fortunate to serve? And so, how that voice is heard at that very important table is important. And then, last but certainly not least, on the advocacy side, making sure that our our dynamics within healthcare and the nuances that we're facing right now, we're at a very interesting sort of point within our maturation, that our legislative officials understand that, and that advocacy work I'm deeply entrenched in and passionate about, making sure that our legislative officials understand just how important our hospitals are to the ecosystem of our country.
Such important work. Um, so, shift gear to talking about your leadership style. What is one quality that has given you an edge in your career, and how has it evolved throughout your career?
I am very straightforward when it comes to leadership. People work with me, they don't work for me. And I believe that I have created teams of teams, where we have common goals in place, where we are all rowing in the same direction. We may not always agree, Vaughn, and that's the nature of people. But when we walk out of the room, our teams walk out with one voice. And so, with that, I think that has been a very, very important part to my career trajectory, having individuals who I support, who I help lead, who I work with, that are very talented, but also that we can agree to disagree, but we can walk out of the room and ultimately execute together and get the things done that are necessary.
That's great. And To that extent, let's talk a bit about employee engagement and satisfaction. Ardent Health has been a perennial winner of modern healthcare's Best Places to Work program for many, many years, with a number of hospitals, anywhere from six to a dozen, that have made the list time and time again. So, what would you say were the success factors that have contributed to your employee engagement and satisfaction?
Sure. Yeah, first of all, I've been with Ardent now 2 years, and the hospitals that have had that continued success, you walk in the door, Fawn, and there is a feeling. It's a different feeling, and to put words to it is probably a little bit difficult, but it's a family environment. Everybody cares about everyone. There's a vested interest in the its success of that coworker that sits next to you. There's a warmth that the patient and the visitor and the community feels walking into that door, and that's created by, I think, that familial culture that exists. And I think from a corporate perspective, how we've been able to drive that is really truly fostering that level of ownership at the local level, and individuals feeling like this is my family, this is my hospital, this is my community, and they want to put the best foot forward. And I think that's the secret sauce. It's the ownership and buy-in.
And it's so wonderful at every Best Places to Work Awards program to see the level of camaraderie and the excitement by your team members that attended the event. So, congratulations and good luck. So, I've talked to a lot of women, and myself included, that we at one time or another have felt the imposter syndrome. So, I wanted to know from you, have you ever felt the imposter syndrome? And if so, how did you navigate your way through it?
I'm first of all, I'm glad this question is coming forth, right? We don't talk about this enough as women. I think there's a hesitancy to kind of allow people to see behind the
Mhm.
curtain of yourself. I've absolutely felt that imposter syndrome. I've felt it multiple times in multiple ways in multiple environments, and it's like a creeping sort of wave of panic, right? Like you have this very defined moment of panic around, am I in over my head? Am I in the right place? Did I make a wrong decision? Am I really able to be here in this environment, in this seat right now? And every time I have had that moment, I just try to like calm and recenter, because I have to realize and allow myself to own the fact that I've prepared for these moments. And the road that I've taken has gotten me here, not by some luck or chance,
Yeah.
but through hard work. And when you recenter and kind of allow yourself the moment to breathe through it, it's easier to kind of navigate. But I wish that it would ultimately go away. I know that's just a part of life in some points, but I've definitely had those waves of imposter syndrome and really questioning, should I be here?
Absolutely. And that is the great tactic, right? Strategy to addressing or to calming yourself down and reminding yourself of why you're there, right? The reason why you're there. So, thank you for sharing that with us. So, we all know that there are real barriers to career advancement for women and minority groups. What has been the biggest barrier in your career, and how have you overcome it?
Yeah. From a barrier perspective, I think that there has been a number of things, if I would say, that have come my way in terms of why I was not, the right fit or the right person for a role. And I would say a lot of those times it's been age, or it's been, whether or not I was able to do it because I had, other key constituents that needed my time. And at that time in my career, I had young children and things of that nature, right? And so all of those things play a role. I think for me, how I've overcome the barriers is really truly going back and having strong mentors and sponsors. And also recognizing that when your name is brought up in a room, if it's not the right fit at this point, when it's brought up, you're there because they know you can do the job, but the fit is the most important. And if it's not the right fit, then it won't be right for you as an individual, and it won't be right for the organization. And if you can understand that and hold on to that, then it's not really a barrier, right? It's almost like a win for you personally.
I subscribe to that concept. If it's not the right fit, it's not going to be good long term, right? So ultimately it it's just not good for both parties. So uh, fit is so important. So there are a lot of women, young women, women and minority groups that are preparing for their next steps. Their next step into an executive position in healthcare. What would be your advice for those women and minorities?
Yeah. I think taking the time really, Fawn, to engage with those individuals who are in the seat now, understanding the obvious components of the work, right? There's a job description, but then there's the things that we do that are not a part of the job description. And understanding those things as well, what's required, what's necessary, what sort of things that are important for success, I think are very, very important. Having that sort of insight into the roles, very, very key in terms of being able to be successful. I'd also add, I think that making sure that you have a strong platform to stand upon, because when you're in these seats in an executive role, it is important to have people who can help you with every aspect of your life to be successful. And so,
Yeah.
whether that be at home or at work, making sure you have the right support systems to be able to be successful in the role. And then I always say this, and I'll probably say this every day of my life, like mentorship, mentorship, mentorship.
Great
Keep
advice. Mentorship and sponsorship, right? From both men and women. Yes.
Absolutely. And I think mentors can come in any form. I
Yep.
even have a millennial who's on my personal board of directors. Like, I can learn from anybody, right? That's an important piece to the puzzle.
That perspective is so important, right, to us, to our growth and development as people, no matter how old we are and what stage we are in our career, right?
Absolutely.
So, speaking of mentorship and sponsorship and support, how can women support other women in their organizations? What can we do to effectively support other women?
I do think, being a sponsor is an important responsibility for women executives. You needed a sponsor, everyone's needed some level of support to get to where they are today. And so being intentional about mentorship, about sponsorship is very important. And I think I said this to you earlier, Vaughn, this is an ecosystem. So everybody that I mentor, I tell them they are now responsible to do the same for someone else, because there's someone else looking to get into their role. And
Yep.
this has to be a constant sort of pull and push forward. And I think that as long as we have that mindset and really realize that there's a level of intentionality that needs to be a part of this, I think then we will allow for that next leader, that next female leader, that next minority leader, to shine and be able to be seen in the proper light.
I love that. So paying it forward is so important. We don't do this alone. We don't get here on our own. And but being really mindful and intentional about reminding people of that. I'm going to help work with you, mentor you, sponsor you, but you're going to have to take that responsibility and do it for somebody else in the future. That's so important to remind folks of. It's great. Thank you. I would love to know who has inspired you to be a leader and why.
I've had many people who've inspired me. Probably the one that sticks out the most for sure is my mother. My mother was the first in our family to receive a graduate education as well as an undergraduate education. And she really inspired me to follow my dreams and to be the best at whatever I decided to do. And so for that, I'm always grateful. And she's my greatest inspiration.
Isn't that wonderful to have strong mothers? And we're so, so lucky.
Absolutely.
What advice would you give to your younger self, your 30-year-old self?
Yeah. I would say listen more to your gut. Your gut is going to be an important guide in your path, and to quiet your mind. So often the mind just will literally pivot you from your path. You allow for that self-talk to drive maybe a false step. So quiet the mind, listen to your gut.
Great advice. Thank you. Terika, thank you so much for sharing your time and insights with us today. You inspire me, and I know our audience that is listening right now. Thank you for your leadership and for your commitment to advancing women, diversity, equity, and inclusion in healthcare. Thank you also for being such a valued member of our Women Leaders in Healthcare Conference Advisory Board. You've been instrumental in helping us building uh, the programming for this year. So thank you. And I'm really looking forward to continue this conversation at the conference, which is going to be from August 9th to 11th in Chicago. So I look forward to seeing you there.
Absolutely. And thank you so much, Fawn. And thank you for being such a wonderful example of leadership and women leadership.
Thank you, Terika. And to our audience, thank you for tuning in today. And I look forward to seeing you at the next Fridays with Fawn. And for sure, I hope to see you at the Women Leaders in Healthcare Conference this August in Chicago. Thank you.